Good afternoon, everyone. Good afternoon. Welcome to the Greater Chicago Food Depository. I'm Amy Laboy. I'm Vice President of Programs and Community Partnerships here at the Food Depository. It is always wonderful to look out and see all amazing partners in a room together. I'm so excited for today, celebrating this opportunity that is an important one for our state and our neighbors. Thank you all for being here. The Food Depository is honored and proud to host this celebration today. We are extremely grateful for Governor Pritzker's leadership in advocating for approval from the Centers for Medicare and Medicaid Services for Illinois' Healthcare Transformation 1115 waiver. This policy change represents a pivotal moment in the way our state addresses health disparities and health-related social needs. So let me start by saying thank you, Governor, for your commitment to improving the health outcomes of Illinois residents. We are so proud that our state has a leader who works tirelessly to make sure that Illinois is at the forefront of addressing social determinants of health. The Greater Chicago Food Depository believes that a healthy community starts with food. For many years now, food banks have been working at the intersection of hunger and health, driven by the understanding that food insecurity, chronic disease, and costly health outcomes are intrinsically linked. For many of the people we serve, and more across Illinois, the stress of food insecurity is coupled with the impacts of diabetes, hypertension, obesity, and chronic disease. More and more households are experiencing food insecurity and having to make difficult decisions between buying food or buying medicine or medical care. It's an impossible decision that no one should have to make. To make matters worse, many families are also at increased of experiencing housing instability, violence, and behavioral health issues. That's why we are so excited about this opportunity to think differently about how we address health-related social needs. This waiver represents a significant acknowledgement that social needs such as food and housing are important aspects of improving health outcomes. I can't wait to see what the expanded Medicaid coverage through the 1115 waiver will bring for Illinois residents, and how it will impact the work that the Food Depository and other community groups have been doing for years. The opportunity to create a sustainable infrastructure and new partnership for this work is upon us. The Food Depository stands ready to support the governor, our state leaders, and collaborate across sectors to fulfill this promise. Thank you, Governor Pritzker, for your leadership in addressing the disparities and inequities that prevent our neighbors from reaching their full potential. We are grateful for our many partnerships with you, the state of Illinois, and other leaders in this room to make sure that Illinois is the best place to live and work. And now I am honored to introduce Governor JB Pritzker.
Well, good afternoon, everyone. Good afternoon. Oh no, we're here with Tony Preckwinkle. We don't say good afternoon at a low tone. Good afternoon. Good afternoon. Love to hear that. Thank you all for joining us and helping us lift up another important victory in health and equity here in the state of Illinois. I first want to thank Amy. Thank you for your leadership. Thank you for your kind introduction. Thank you for the staff that you've brought together here at the Greater Chicago Food Depository. This really is an important day, and I can't think of a better place to celebrate that than a place that is consistently helping people across the city, across the state, and setting an example for the nation. The past few years exposed many of the painful, persistent weaknesses in our public health infrastructure, requiring us to rethink what a smart and equitable healthcare system should look like. Central to that rethinking has been understanding the forces driving health disparities and investing the necessary resources to address them. That work has led to the development and deployment of comprehensive, forward-thinking public health strategies designed to confront head-on social and structural determinants of health. We're here today to announce something truly, truly exciting. I mean, Illinois is on the forefront. And this is an important day. I know it sounds at the headline when we say things like an 1115 waiver. It doesn't sound all that exciting, but let me tell you how exciting it really is. We are leading the nation in this work because there was an effort to reach out and make it so with the Center for Medicare and Medicaid Services, which has now approved an extension of our 1115 demonstration waiver, giving us new authority and flexibility to develop innovative ways to advance access, quality, and equity in healthcare, and reducing the burden on Illinois taxpayers for this important work. Here in Illinois, the 1115 waiver is the cornerstone of our broader strategy to address health-related social needs. We're using it to direct Medicaid resources toward initiatives that address the root causes of health inequalities, such as housing, food insecurity, unemployment, violence prevention, reentry from prison settings, substance use treatment, and so much more. When these basic needs like housing and nutrition go unmet, individuals are 2.5 times more likely to have poor physical health, 5 times more likely to have mental health challenges, and twice as likely to report higher healthcare utilization. You've heard the expression, an ounce of prevention is worth a pound of cure. Well, that's what this waiver means for Illinoisans all across our state. With this extension, we can build on the demonstrated success of programs that meet these needs: housing support, food and nutrition services, employment assistance, community reintegration, while developing and piloting new solutions to ensure that we're meeting the needs of all Illinoisans. Success in this mission has required a collaborative effort from state and federal agency staff, legislators, community organizations, health experts, and more, many of whom are here with us today. And I just want to say from the bottom of my heart, because I know all of you have worked together to help make this happen, thank you. Thank you on behalf of the 13 million people of the state of Illinois. So there are lots and lots of thank yous. I'm not going to get to everybody, I have to admit, but let me start by thanking my cabinet members and staff from agencies across state government who work to make this happen. I'd be up here all day if I tried to list even just all of those people, but I want to make special mention of our Healthcare and Family Services Director, Lizzie Whitehorn, and her incredible team. So let's give her a big round of applause. And it would be remiss on my part, I would be remiss if I didn't recognize my Deputy Governor for Health and Human Services, who I get to work with every day in the office and who Lizzie Whitehorn got to work with as well, and that's our great Deputy Governor, Grace Ho. Now, this is where the list would get long, and I'm going to offend some people by not mentioning their names, but I want to just say our partners in the General Assembly have been unyielding in their commitment to the health and prosperity of Illinoisans. Since I've taken office, being able to work with these fabulous people, and we have senators and House members, people who every day think about the health and safety of the people of Illinois, and I'm just so fortunate to be able to have these kinds of partners to work with. So thank you to the General Assembly for making all of this happen. And then here, representing the entire federal government, is Mike Cabinargi, our friend, our home Illinois guy at the U.S. Department of Health and Human Services. Thank you. He's regional director now, but I guarantee you he is moving on up and going to run the entire government at some point. So thank you very much, Mike. And lastly, those in the community whose firsthand expertise and experiences shaped this effort. Amadou Drame, who you're going to hear from the Illinois Justice Project, as well as Chad Williams. Chad, thank you. I know that you have a story that you're going to share with us, your own story. Thank you for sharing your experiences and helping to uplift others. Thanks to the tireless efforts of all of these folks and innumerable others, vulnerable residents across the state of Illinois have a comprehensive network of services and support that will promote their health and well-being and provide a foundation to thrive well beyond that. Illinois is leading the way in this work. I want to repeat that because I feel like for so many years we never heard those things at a podium in Illinois, but we're leading the way in the nation in this work, and we're once again setting a national standard for what equitable, effective, and people-centric health care should look like. Today is a day that all Illinoisans should take great pride in. So with that, I am very proud to hand this podium over to a champion for quality health care and prevention, a friend to all people in the county of Cook, but also across the state of Illinois because she is a pioneer in her own right, President Toni Preckwinkle.
Good afternoon, everybody. Good afternoon. I'm grateful to be here to celebrate the approval of the 1115 waiver. While they could not be here today, I want to acknowledge and thank Senator Durbin, Senator Duckworth, and all of our congressional delegation, and thank who is here with us, former county official Mike Cabinargi, now Regional Director, HHS Director, and all of our federal partners for their help. I want to express my special appreciation to Governor Pritzker and Director Whitehorn for their leadership. Thank you. This comprehensive waiver addresses many of the risk factors that impact the health of our communities, and I appreciate the state's partnership. Thanks, of course, to the Greater Chicago Food Depository for hosting us, and I want to thank our state legislators. We've been joined by leaders in the Senate, Leader Matty Hunter, Leader Omar Aquino, Senator Sarah Feigenholz. In the House, Leader Camille Lilly, Leader Robin Gable, Representative Dagmara Avalar, Representative Selena Villanueva, Representative Ann Moeller. Thank you very much, state legislators, for joining us. The Illinois healthcare transformation will allow Medicaid to cover a new set of health-related social needs that are often present among Cook County residents. This is especially true for those who rely on the Medicaid program. The majority of insured patients at Cook County Health rely on Medicaid as their primary payer. As a result, the Illinois healthcare transformation is a welcome opportunity to holistically address the needs of our CCH patients with Medicaid coverage and our county care members. New services such as housing and housing supports, food and nutrition services, violence intervention and prevention services will now be reimbursed by Illinois Medicaid. This will provide new opportunities to expand access to these critical services. I'm proud of the work Cook County Health has initiated to pilot some of these critical services, relying on access to limited grant dollars. Some examples include establishing a medical respite center with Housing Forward, which is a not-for-profit organization that works around homelessness in Evanston, partnering with the Greater Chicago Food Depository to address food insecurity among patients, and engaging in critical work with trauma victims and their families around violence prevention. Additionally, I'm pleased that the Illinois waiver will support reentry services for individuals leaving Cook County Jail and other correctional facilities around the state. Cook County Health Cermak Health Services has long provided comprehensive physical and behavioral health services to detainees at Cook County Jail. We look forward to building on the high-quality services already in place to improve community integration and reduce recidivism. Cook County looks forward to operationalizing the waiver with our state to implement these new benefits. Through this work, we will improve the health and lives of Cook County residents and residents throughout the state of Illinois. Thank you very much. And now it's my pleasure to bring to the podium Director Whitehorn. Thank you.
Thank you, President Preckwinkle. Good afternoon. I'm so excited to be here with you today to talk about the recent federal approval of Illinois' Healthcare Transformation 1115 demonstration waiver. Thank you, Governor Pritzker, for your leadership and for allowing us to do work every day in service of what you have said since the beginning of this administration. In Illinois, healthcare is a right, not a privilege. A big thank you to our federal partners, especially the U.S. Department of Health and Human Services, Region 5 Director Mike Hubnarji, who is with us today. The Medicaid program is truly a federal-state partnership, and we could not be as innovative as we are in Illinois without their support. I want to thank Kate Mayer, who couldn't be here today, and my friend Amy Laboy and the Greater Chicago Food Depository for hosting us. Thank you to the legislators who are here today, including Leader Lilly and Leader Gable, Senator Aquino, Senator Hunter, Senator Villanueva, Senator Feigenholtz, Representative Avalar, and Representative Moeller, all of whom are wonderful leaders in the healthcare space working with us. I want to thank our MCO partners and representatives from community organizations on the ground serving our customers. I also have to give an enormous thank you to the HFS staff for your tireless work on this waiver application. This was an enormous team effort that will have real impact on people's lives. The federal approval of HFS's 1115 waiver earlier this month touches off what will be nation-leading work in the Illinois Medicaid program to meaningfully address health-related social needs and the root causes of health disparities. 1115 waivers are designed to allow state Medicaid programs to test the impact of innovations that are not traditional medical services and therefore have not been covered by Medicaid. This is transformational because it gives us the ability to better address the root causes of health disparities where they stem from, to prevent them from becoming adverse health outcomes down the road. For many years, researchers have known that if someone is not housed or can't access food, their health outcomes will be worse. Studies have repeatedly proven that social determinants of health factor heavily into an individual's health outcomes. The U.S. Department of Health and Human Services last fall issued a call to action to address health-related social needs in communities across the nation, citing research that shows social determinants of health account for about half of the variation in health outcomes in the nation. The newly approved benefits fall under 4 categories of work. The first addresses a specific set of health-related social needs, including housing support for individuals who may be transitioning out of a long-term care facility, out of foster care, or after a period of experiencing homelessness. The supports include short-term post-transition housing or rental assistance, medically necessary home remediations, and medical respite. We will also be able to provide food and nutrition services not previously covered by Medicaid, including nutrition counseling, home-delivered and medically tailored meals, and nutrition prescriptions targeting health risks. Second, along with these services, we will be able to cover transportation to and from health-related social needs service providers. We are one of only a few states approved for this type of transportation to be covered under an 1115 waiver. Next, Illinois is the first state approved to address community violence under an 1115 waiver, allowing for screening and needs assessment, trauma therapy, and other services for Medicaid beneficiaries who have survived violence or are currently experiencing or at risk of experiencing violence. This work will support and complement the state's ongoing initiatives under the Reimagined Public Safety Act and will be coordinated closely with the Office of Firearm Violence Prevention. Finally, Illinois is among one of the first cohorts of states to provide reentry services for individuals being released from a carceral setting, including coverage of pre-release services that can begin up to 90 days before release. By moving toward Medicaid coverage of services that have otherwise been provided in siloed state agencies and from different levels of government, we can propel the groundbreaking work of this administration to prevent and end homelessness, to prevent firearm violence, and to better support reentry. To that end, there are many state and local leaders here today. I want to recognize in particular leaders from the Lieutenant Governor's Office, the Department of Human Services, the Department of Corrections, the Department of Juvenile Justice, the Department of Public Health, the Illinois Housing Development Authority, and the Illinois Criminal Justice Information Authority, as well as our partners at Cook County. We will be working with all of them to implement this transformational work over the coming years. This is just the beginning. With this approval, we enter into an implementation planning phase. We will be working in close collaboration not only with our sister agencies, but our community partners, MCOs, healthcare providers, customers, and federal CMS to stand up these services in a thoughtful and responsible way. We at HFS look forward to continuing to work in partnership with everyone here today to implement coverage for new services that will impact so many Illinoisans in the years ahead. Thank you, and now I'm pleased to turn it over to Mike Cabanargi.
Hi, good afternoon. I'm Mike Cabanargi. I think I'd be used to that by now. I'm Mike Cabanargi. I'm the Regional Director for the U.S. Department of Health and Human Services for the Midwest region. So that's Illinois, Michigan, Ohio, Indiana, Wisconsin, Minnesota, and then our 34 sovereign tribes, 11 in Minnesota, 12 in Michigan, and 11 in Wisconsin. I want to thank the governor for his kind words and President Preckwinkle. This is an exciting moment. The Biden-Harris administration is working to ensure every American has access to high-quality, affordable health care, and creative leadership like Illinois' strengthens health care coverage for American families. Illinois today joins a growing roster of states that recognize a simple truth. Health care can and should mean care for the whole person. We applaud Governor Pritzker, the Illinois General Assembly, and the extraordinary team in Illinois government for using every tool available to improve quality and access, reduce health disparities, and improve health equity for those who need it most. At HHS, we look forward to more states following Illinois' example. As part of the Biden-Harris administration's efforts to build a healthcare system that benefits all Americans, the Centers for Medicare and Medicaid Services, or CMS, approved Illinois' amendments to the Medicaid system to bundle a series of actions to advance health equity and allow Illinois to make large investments in wide-ranging Medicaid initiatives, including connecting people to crucial housing and nutritional support services, and enhancing access to coordinated and comprehensive treatment for substance use disorders. As the nation's largest insurer, CMS is proud to approve Illinois' critical demonstration amendment, which gets to the heart of Medicaid's role as an innovator. The 1115 demonstration program allows CMS to approve innovative projects that promote the objectives of Medicaid, provide health coverage to millions of low-income adults, children, pregnant people, and people with disabilities. Illinois' demonstration initiatives will provide this broad range of health and social supports to underserved communities, improving their health and quality of life. Across these and other efforts, CMS and the state of Illinois will monitor progress through rigorous independent evaluations to determine the outcomes and the impacts. For people in the justice system in particular, ensuring a successful transition back into the community includes having the health care supports and the services that they need. There is significant health coverage and continuity of care needs that justice-involved individuals face when returning to the community. These include disproportionately high rates of substance use disorder, opioid overdose, serious mental illness, and chronic physical conditions. Opportunities like Medicaid reentry demonstration projects have a track record for improving health and human care transitions. Now, for the first time, thousands of incarcerated people in Illinois will have critical supports during their transition out of a carceral setting, thanks to this important health care coverage. Once again, Illinois is to be commended for acknowledging the connection between the social determinants of health and health care and taking this essential step for advancing health equity in the Midwest. Now it's my pleasure to introduce the Majority Leader of the Illinois House of Representatives, State Representative Robin Gable. Leader Gable is also the co-chair of the Medicaid Working Group. Leader Gable.
Thank you, Mike. Can you hear me, or do I have to move this down? Okay, great. So thank you so much. Again, my name is Robin Gable, State Representative and Majority Leader in the House. I did run the Medicaid Working Group this year, and it was an exciting experience. We had, I don't know, maybe 50 bills we had to go through and decide which ones that we were going to pass this year. The 1115 waiver will make that work so much easier. I really want to thank Governor Pritzker, who I learned this morning wants to make Illinois the best state in the union for families. Yay. Illinois is taking a truly transformative step in addressing the root causes of health disparities. Our health is not only our medical care, but it is the sum of all of our experiences, our jobs, our homes. So in caring for some of the most vulnerable populations, we need to account for issues from housing to food insecurity to transition from incarceration. Under Governor Pritzker's leadership, Illinois is recognizing that a comprehensive approach to health care must be rooted in compassion and must treat the whole person. We've taken many important steps together to expand critical health services covered under Medicaid, from increasing access to specialists to expanding coverage for mental health. This is another critical step. I'm proud to stand here today and applaud another important step in this direction and look forward to working to continue moving Illinois forward. As was said by Lizzie, on to implementation. It is my pleasure to introduce a friend, a colleague, who has been working with me in the House. We came in about the same time, and we've seen a lot of change, and we've made a lot of changes. So please welcome Leader Camille Lilly.
We have to lean on each other to get things done here in the state of Illinois. I would just like to start, again, I'm State Representative Camille Lilly here in the state of Illinois, and I have to say we are all excited that our governor sees how important our needs are here in the state of Illinois, and he has come forth to celebrate the approval of the 1115 waivers. Can we give him another round of applause? I too want to thank the federal government for having the waiver program. Thank you for allowing us to have the vision to address the needs of the people of Illinois. And yes, HFS, you are some hard-working team. We couldn't do this without you. Thank you for all the work that you do on behalf of Illinoisans. And as Robin mentioned, we came in together, but there are so many people here before us who work on the Medicaid work group that has come to do the work of the people and work alongside the staff and the governor to bring this program forward. Can we give the Medicaid work group a round of applause? Now, this measure will give the most vulnerable population hope as they navigate the health disparities that shows up in social influencers, which I like to call them, but many of you call them social determinants of health. It goes without saying, those at risk, when they don't receive the resources in a timely manner, they become the most vulnerable population, having the ability and having the inability to address some of the biggest problems that are in their lives. But this program, this waiver, will allow them to address homelessness, addiction, and the disparities. As the chair of the Forbes Health and Human Services, I am glad to be a part of this program. Again, all the services that have been mentioned, they're flexible to our targeted population. All the services that have been mentioned brings additional service in a demonstration that allows us to address the quality of life. Again, all the service that many of you provide bring the quality, the access, and equity in healthcare. I just want to say this program allows us to address life expectancy, improve health outcomes, and I, along with many of the colleagues in the General Assembly who voted for this legislation because we knew it was important, we see, and it is our obligation to work with each and every one of you. With that, it is our honor to say thank you again to Governor Pritzker for understanding the importance of quality of life for all Illinoisans here in the state of Illinois. With that, I'd like to bring forth the leader in the Senate, one of them, who I work with so diligently, Senator Aquino, Leader Aquino.
Thank you. Good afternoon. We got to be a little bit more cheerful this afternoon. Good afternoon, everyone. Let's clap it up because this is a celebration here. We are celebrating a transformative waiver, the 1115 waiver that gets to really address social determinants. What is that? What is for folks that don't work on healthcare? That is, they're non-healthcare issues that really have a great impact on your health and on community health. Data shows that sometimes those social determinants have a greater impact than your personal choices and even your healthcare access at times. Being able to address housing, food security, or providing services for those reentering into our communities is going to address not only individual health, but also the health of our greater community. This is going to impact generational health for our communities that have been healthy for many years. That COVID just highlighted and exacerbated what we have seen for many, many years, which is if you do not have access to affordable housing and don't know if you're gonna have a roof on your head, you cannot address your own health. If you don't have access to affordable and quality food, you cannot be healthy. This waiver allows for us to rethink how we can address people's health here in the state of Illinois. And I want to thank the leadership of our governor of HFS. HFS, actually, I want to give them a shout out. They go into community. We just came from a meeting where the chief of staff was in community in Humboldt Park, at Humboldt Park Health, talking about different ways of, again, trying to address the health care of our most vulnerable folks, especially those that are receiving Medicaid. So I just want to, again, clap it up because this is a celebration, you all, and we got some somber faces out there. We need to celebrate this win for the state of Illinois, and I'm looking forward to continuing that work in the Medicaid work group. And with that, the next speaker is Director Amadou Drame, and apologies if I did not get that your name correct. Thank you.
Okay. Well, good afternoon. My name is Amadou Drame, you got it right. I serve as the director of the Illinois Justice Project. We advocate for policies and practices that make the criminal legal system more just, communities safer, and we also convene the Illinois Reentry Council, which is a 200-member group of like-minded people working to create an effective reentry process and system throughout Illinois. I would like to first thank Governor Pritzker and his team, including my good friend and LGC classmate, Director Lizzie Whitehorn of HFS, the good folks at DHS, the teams there, and the countless others who made this equitable and innovative piece of public policy a reality. And thank you especially to the Illinois Department of Healthcare and Family Services for applying for an expansion on behalf of Illinois and for recognizing that people who are incarcerated in this application are just as deserving as anybody else for access to care. And thank you, of course, to the U.S. Department of Health and Human Services and Senator Durbin, who's not here with us today, but certainly with us in spirit, for the work to secure this application's approval, and I'm sure there were countless others who were part of the Illinois delegation. Today, there are nearly 1/3 of the Illinois adult working age population has an arrest or conviction record. In Illinois alone, there are 4.1 million people who have an arrest or conviction record. If all arrested Americans were a nation, they would be the world's 18th largest, larger than Canada, larger than France, and more than 3 times the size of Australia. Roughly 30,000 people are incarcerated in Illinois prisons, and 9 out of every 10 of them will eventually return to our communities. They face barriers to employment and legitimate economic opportunities, housing, and health care, among countless other barriers. Barriers that increase the likelihood of them returning to prison despite their best efforts not to. Incarcerated people and formerly incarcerated people are often overlooked or dismissed as not worthy of the same support and opportunities that anyone else in this country expects. But the truth is, being sentenced to prison should not be a sentence to sickness or disease. It should not erase your eligibility to a health care program that can prevent that. And after paying their debt to society, returning residents should be entitled to the supports that help them successfully navigate reentry, that process after prison and jail. For generations historically, the federal government, and this is not a dig on anybody here, but it just has been the case historically, had designed and operated the Medicaid program in ways that brought inequities and harm and great division to families and communities of color. However, this Illinois version of the program and this new expansion expands coverage to include those people and communities that this government policy and program had once harmed. The expanded healthcare transformation program lays the foundation for Illinois to provide new and more robust services for people leaving carceral settings, and that is significant. People who are incarcerated can begin receiving Medicaid coverage services 90 days prior to their release from prison. These services include physical and behavioral health clinical consultation services, laboratory and radiology services, medications, and medication-assisted treatment. Under this program, people can now leave prison with a minimum of 30 days supply of prescribed medications, over-the-counter medication, and durable medical equipment. People can also receive Medicaid covered reentry navigation supports under this waiver. Offering such support is essential to people who are returning home, often after years of separation from all support systems and loved ones. They have essentially nothing, and yet we expect them to find a job and a home and become a contributing member of society. This is hard enough when you are healthy. Imagine when you are ill and have no way to get medical advice or help. So ensuring effective reentry in Illinois is complicated, and much work remains if we are to have sustained and equitable policies and practices. But today, I'd like to celebrate and thank all those who worked to ensure that this piece of the puzzle is in place, offering much needed support to the incarcerated people in our society and our state. The Illinois Justice Project and Illinois Reentry Council also stand ready to work on implementation and to support that. And again, I thank you very much. And now I will pass it to Chad Williams, who is, I believe, a former consumer with Housing Forward, but now a volunteer with them.
Well, good afternoon. Good afternoon. Thank you for being here today. My name is Chad Williams. In the winter of 2017, I was being discharged from West Suburban Hospital in Oak Park, Illinois, after being treated for congestive heart failure. Afterwards, I found myself with nowhere to go. I had spent quite some time living on the streets of Chicago, and then my health failed me. I hadn't had a plan or a place to stay, so I wound up in West Suburban Hospital needing treatment for congestive heart failure. I found Housing Forward afterwards through a doctor at West Suburban, and for 2 years from 2017 to 2019, I stayed at Housing Forward's overnight shelter. I received warm meals, a safe place to sleep, and eventually it came to be like home. When Housing Forward opened Sojourner's House in 2019, I was one of the first residents to move in. Being at Sojourners allowed me to temporarily enjoy the human experience once more, as being without a home can take away from you. Sojourner's House provided me with a safe place to recuperate, time to think in a better social structure. Today I'm doing well, and I have been in my apartment for 4 years and have access to quality, affordable health care. This has made a big difference in reaffirming my trust in people, and having consistent health care has literally meant the difference for me between life and death. The kind of health care I have now is unparalleled for me. I feel like somebody cares now. I hope that this expansion of services will mean more people like myself will be able to receive the medical and housing support that they need, and a greater chance to address their health problems. Thank you for your time and your willingness to hear my story. At this time, I'd like to invite Governor Pritzker back to the podium.
Happy to take any questions from members of the media. Yes. It is. As a matter of fact, I think one of the things that we've learned is that the earlier we can get people access to housing, to health care, to nutritious meal, to ultimately to a job, the better off we all are and most importantly, the better off that person is. And I think over the years, one of the things that has been overlooked is the importance, we talk about social determinants, but the importance of these things in someone's life. It's not just that they're being released from prison and, great, there's all kinds of places to go and things to do. No, as a matter of fact, being able to have the comfort of knowing there's a place for you to live, that there's health care available for you immediately. I want to just tell you one example of what's needed and how long it's taken to get there, and now what we have the opportunity to do. My wife has been very involved in, focused on incarcerated women in Illinois. It turns out that when we came into office, and she really dove into this, and she had been involved with it before we came into office, but she found out that men who are released from prison actually were being offered Medicaid immediately, because the Safer Foundation works with a lot of the incarcerated men, and so they had made sure that it was available, and it was, and they had the forms, and they were helped to fill them out, and so on. No one was doing that for women. And so women were being released without access to Medicaid. Not all women, but many. And in Illinois now, as a result of the work she did, women are in fact getting Medicaid nearly immediately. You know what the difference is for these women? It's that there is a security when they're leaving incarceration, knowing that there are people who will care for them, and especially because there are many issues that somehow go untreated when they're in prison, and now with access to Medicaid, they can actually get access to that treatment. So I tell you that just as one small example of what was being done before this 1115 waiver came along, and how we addressed it. But again, incarcerated women are a very small population of the total number that are incarcerated. We have 30,000 who are incarcerated in the state of Illinois. Women make up less than 5% of that. Mm-hmm. Indeed, behavioral health is part of the service that gets provided. I mean, think about it: food, clothing, shelter, health care. Those are the things that we all need in order to survive and live. And so, yeah, it isn't just about people who are being released from prison, those who are returning to their communities, but it is, in fact, also about those folks. Yeah. Yes, ma'am. Hi, Olivia. Are you the only member of the press other than this gentleman? I think so. You all came to our earlier press conference, where, by the way, we announced our birth equity initiative and signing of the bill. It's Healthcare Day today. Olivia. I'm sorry, on whether or not it's going to be clear, what's the update you're looking for? Yeah. First of all, there's no immediate timeline. There's no immediate endeavor to close Stateville. I know that or let me say it a different way. We know that we will be closing Stateville, but we will be replacing it with a new facility that has health care, that has mental health treatment in it, that has the ability to provide classes so that people can actually earn their degrees. This is something that, as you know, we have some of our facilities that are 100 years old. In fact, one of them is almost 150 years old. Can you imagine that those were not built for people to be able to rehabilitate? They were just for punishment alone. So we want to replace those old facilities with new ones, and Stateville is a primary one of those. The timeline is not set, but as you know, there have been hearings so that people could express themselves in the communities where there are concerns about this. But importantly, the faster we get to work building the new Stateville facility, the better off those who are incarcerated will be, and the better off, by the way, that the correctional officers will be. Is it still possible? I just can't hear you very well. I'm sorry. Well, we wouldn't be able to build the new facility in September, yes, but it is absolutely possible that would be the timeline. Again, some of this is we've got to do engineering and planning, and there's a whole lot ahead of us before we'll actually be able to build the new facility. But importantly, it is possible whenever we're able to start that process that facility would be shut down, and those who are incarcerated there would go to other facilities on a temporary basis. Yeah. I'll correct your timeline. I think I said no on Tuesday morning, that I had not received vetting documents. And then subsequently I was asked the question, just so you can go back and look at your records. And what I've said repeatedly since then is that, I'm not going to talk about the conversations that I've had with the vice president or with her campaign, other than to say that I have committed myself to Kamala Harris, that I will go out and work my heart out for her to win this election, because we cannot have Donald Trump as president of the United States.